Vaccinations right now are stalling, and today is the first day where health orders in Ohio are no more. But the virus is not gone, and health leaders are urging people to remain cautious and protect yourself. Local 12's Cassie Arsenault joining us now with that part of the story. Cassie, good evening.
Good evening to you, Kyle. 5.3 million Ohioans have been vaccinated. That contributes to our 53% immunity here in Ohio, but it's still not herd immunity by a long shot. So we are responsible for protecting ourselves. Now, when you think about that 53% number, you want to keep in mind that it does take into account the 1.1 million who have contracted COVID, which means 6.4 million people are considered immune out of the 11.8 million living in the state. That's where we get that 53%. Now, the goal in Ohio is to have 80% vaccinated by July 4th, which is more than what the national goal is for that same date.
So, Cassie, that begs the question, if 53% is not enough, what are we likely going to see? Will there be a breakthrough of COVID cases, or are we expecting to see a resurgence?
Well, we could see some pockets of COVID pop up like you would in measles. If you go into a community where people are not immune, it could still spread, and it can spread fast. As for those breakthrough cases, no immunization is 100%. That depends on your immune system, but there are very few breakthrough cases at this point, according to health experts. Another thing we want to keep in mind is that we are approaching the summer, so a lot more ways to social distance. And I spoke with the medical director of Hamilton County Public Health, who said kids under 12 and those who are not eligible for the vaccine are still in danger until the percentage of people vaccinated increases. And while masks are no longer required, there are some places that may never stop using these guidelines.
Just like airports after 9/11 changed, never really reverted back. And so you will see changes for a long time in your healthcare settings. For the foreseeable future, we in healthcare will continue to do what we've been doing all along, without changes. And so that might surprise some folks. You can't just sort of walk into the hospital without a mask, because there are rules. There are vulnerable people in our healthcare settings that we are continuing to protect.
Now, Dr. Fagans also said it's important to remember that these mandates weren't canceled because there's no threat. They are taken back because now we have more tools in our toolbox to defend ourselves against the virus. And he said that's largely due to the vaccine. Back to you.
All right, Local 12's Cassie Arsenault providing us with some good perspective tonight. Cassie, thank you.